Hi, Robert Galarowicz with Healthy Kidney Inc. And a question we got today was, is kidney disease painful and is dialysis painful? Not such a simple, straightforward answer, but I'll answer it here. So, in general, chronic kidney disease is not painful. Pain is just not one of the main symptoms that you can experience. Can you experience it? Yeah, but it's not one of the main ones. Now, if you have a kidney stone or a kidney infection, those can be very, very painful. But chronic kidney disease generally is not painful. It's just not one of the main symptoms and not something people experience. Now, with dialysis, is it painful? Yes and no. So let's go over the two different types of dialysis. There's hemodialysis, where you go to a dialysis center and they do the dialysis there. And then there's peritoneal dialysis that you can do at home. Now, for decades, hemodialysis was the preferred option, considered superior to peritoneal. But as time, better technology, in recent studies in the last few years, they actually look about equal. Now, with hemodialysis, you have to get an access, somewhere they can put the two dialysis needles so they can filter all your blood through this machine. And they usually prefer what's called an AV fistula, arterial venous fistula, where they take an artery and they take a vein in your arm, they connect them, and that artery sends more blood flow out, allowing the vein to grow larger so that the dialysis needles can easily access it. Now, I still have mine here. I did 2.5 years on hemodialysis. You can see here, that's my access, and the surgery for this is painful, okay? It's a long cut, and depending where they do it differently with everybody. It depends where the best access is for you. So that surgery is painful. Dialysis, when you first go in, they have to access you, so they put two very large needles into your fistula, and that's painful. Over time, you'll develop a lot of scar tissue, and it won't be as painful, and you might not even notice it sometimes. The actual process of being there it's not painful. You can suffer a lot of other symptoms, but pain isn't one of them. So generally, I wouldn't say pain is a big symptom of hemodialysis. It can be to some degree for some people, but there are a lot of other symptoms like dizziness, headaches that you may suffer more and that are much more frequent than pain. Now, with peritoneal dialysis, you have a tube inserted into your abdomen and you do the dialysis at home. And that's a much better quality of life, as studies show, and people that I've talked to have done both. I never did both, I only did hemo, so that's my experience. So that's peritoneal, it doesn't hurt, it's generally a better quality of life from what everybody tells me. And dialysis in itself, it's not something that you want to easily go towards, okay, because it's not a good quality of life. It's not. You're going to have a lot of complications. You really want to do every single thing in your power to avoid it, okay, everything. The reason I'm in this field so deeply is after I got my kidney transplant, they're like, well, it's going to last, maybe 7 years, and I couldn't accept that. I'm like, there's no way I'm going back to this. So I dedicated my life to this through formal education and my own education, my own passion, to find options for people to help themselves. So that doesn't mean you can't have a great quality of life on dialysis. You can. You just really have to control and have a lot of self-care and do things that most people aren't going to do or don't even know about that they can do. So, but overall, pain isn't a big symptom of kidney disease in general, and it's generally not one of the main symptoms of dialysis. Check out our website, More We Can Do, Healthy Kidney Inc. Like, subscribe, and we've got videos coming out all the time and answer questions from our website. Thanks for watching, everyone. To your best kidney health. Bye.